I'm going to give an update on another project that ASAP has funded to look at medical marijuana for Chiari malformation, which we're very excited because we hit the ground running, but we need more. And my plea is to my physician colleagues to really try to get your patients to respond. There's a Q code, and I'll get it out for everybody else as well, because there's some really interesting data. So the study is a collaborative between Global Neurosciences Institute and the Cannabis Education Research Institute, or Chiari, which, excuse me, you heard Mr. Knowlton speak about too yesterday, was generously funded by ASAP, and I think Dave pointed this out yesterday. This is a really bold move. Most organizations would be very worried to fund something that had to do with marijuana, and it just gets to one of those things like, yeah, we think it's great, we know it's helping patients, but we don't really want to get involved in this. And also the patients who participated in this study, we want to thank. I'm not going to get into what Chiari malformation is. Everyone in this room knows that. But we do know that we really have poor pain management for patients, particularly patients with syrinx, where the pain tends to be much more of a neuropathic and debilitating pain. And, we all know the opioid crisis right now. And again, there's a balance. I mean, we can't just throw opioids out the door. I mean, there's a lot of people who can function on a day-to-day basis because of opioids that are very closely managed. But medical marijuana, outside of the medical community, patients have figured this out on their own, and there's clearly benefit to it. And as we talked about yesterday, one of the issues is, it's not like giving a benzo or giving an opioid where there's a very calculated dose response. There are so many different strains. There's so many different ways to take it. There's so many different types of metabolism mechanisms in each individual that there's a big gray zone. So what we tried to do was to really start off polling patients to see, what do you do? What helps? What strains are you using? So that we can put some science to it. And really that's where Chiari comes in, who have university support, basic scientists, people that study cannabinoids, to really try to understand dose, route, and what the disease is that you're treating. So medicinal marijuana is legal in 34 states. Pain is a qualifying condition in most states. And, most anecdotal information suggests that the medicinal is effective for pain in Chiari, but there's really not even no quality. There's literally zero research on it. And our source is all of you, is our patients. So really the question is there an unmet need for patients with Chiari and syrinx? So the factors that we wanted to consider were the amount consumed and frequency, the route, whether it was an edible, inhalation, tincture, and the strain. That's, I think, the big one is the strain. You heard all the names and, Maui Wowie and, Purple Haze and all this other stuff. That doesn't mean anything. What we really have to understand is that THC, CBD composition, balance, and again, I think route and strain are the most important. So the goal of the study was to define marijuana consumption habits in adults with Chiari and Syringomyelia using a survey. So the survey questions included general information, age, diagnosis, medical conditions, medications, consumption habits. I mean, to blend this with what Jerry just talked about would be an absolute home run, because that's really the basis either. What are the other factors in these patients' lives? And then really quality of life before and after. I mean, is it helping you? Do you feel better? Is this something that you feel is helping you? So what we did was we have IRB institutional approval. It's an electronic HIPAA-compliant survey platform called CareCheck, which is really easy. It's a Q code, very easy to give to patients, very straightforward. It's not an overwhelming survey. And they were distributed via both mailing lists through ASAP, as well as through the QR code. And we'll talk a little bit later this afternoon, but this is something we really need to ramp up getting these surveys done so we can get a better understanding. So to date, we have 52 surveys. Actually, I think we're up to 60-something now, but the data we have is 52 surveys were completed. The age range was between 31 and 60 years old. In 70%, 61% reported using multiple times a day. 50% reported consuming less than 1 ounce per month. And the clear strain that was preferred and that most people were using was the indica. 46, there's a hybrid of the indica, but overwhelming was an indica-based, and then a minority of stavia. The preferred method was inhalation in over half the patients, edibles, tinctures, and sublinguals, rounding out the lesser amount. Most reported effects were lasting anywhere from 2 to 4 hours, and I think you can see that if you plot that out with the amount of dosing that people were taking. That seemed to be, in this group, 2 to 4 hours, the peak effect. 63% reported stopping or lowering their doses of other medications, and that's the key thing. The majority of these patients are, particularly the opioids, are staying away from them or at least significantly reducing those doses. And this is, and I'm sorry, it's probably a little blurry at the bottom here, but this is a bar graph showing reduction in pain in patients using the medical marijuana. So no change. There's about 3 patients, 20% reduction in pain, 40%, 20 to 40% reduction you can see is the majority of patients. And a pretty good subset had 60%, and then a smaller 80% reduced pain. But this core of the 60% reduced pain for moderate to severe, those were the patients that were really getting off of other adjunct medications, and not just opioids, but things like gabapentin, Tegretol, other things that have serious side effects. Everyone in this room, I'm sure, is aware of this, and the physicians certainly are, that there are patients who will rather deal with pain than the side effects of some of these medications, which are not subtle in a lot of people. So you can see the results here. It's pretty compelling. It's pretty compelling. Most people were getting moderate to strong results, and almost no one got untoward effects. So there's a bias in here because these are people that have obviously been using this for a while, and they went through that, figuring out what dose they wanted, how often to use it. So interestingly, 0% had unwanted side effects. But if you look at the relief, it speaks for itself. So far, data suggesting that this is clearly effective for pain in patients with Chiari. This is the first study of its kind anywhere looking at medical marijuana for Chiari in specific, and specific strains high in the indica variety seem to, in this cohort, have the most effective results for pain relief. And the purple variety strains were favored. So I'm still doing an education on the different strains. So, and here's a Q code. This is what patients get. These are the resources for Syri, ASAP, and then the medical marijuana. There's a lot of great information in there as well. But please, anybody that is using medical marijuana that has not done the survey, please do it. And we'll talk to the physicians after so that we can get some more patients enrolled. But again, this is very important work, and thank you to ASAP. And it looks like this is something that is not going to go away, particularly for the Chiari population. So thank you.